fact, exercise helps you feel better. Another fun fact, you want to pick the right exercises to help you feel better. My name is Winnie Lingovic, and I'm the creator of the Elevate practice, where we elevate the way you exercise. And this routine are the 4 fundamental exercises that I, at almost 60 years old, do every day to feel better in my hips. Let's try this routine together. And what I want you to think about as you go through this routine is to be a researcher and not a judge, to be curious about how these exercises feel for your body, and not to be so quick to judge yourself if you feel a little bit tight or constricted, because these exercises are designed to help you feel better in the body you woke up in today. Let's get started. The first exercise we're going to do is reclining hip swivel. And to do that, you're lying down on your back, your arms are out to the side, and your feet are a little bit wider than hip width apart. And then we're going to simply swivel our hips. So I'm starting the timer. We're going to be doing this for 1 minute. Now, please remember that if you're not used to doing these kind of exercises, or if anything feels like it's a little bit too much, there's no rule that says you have to do it for 1 minute today. You can just do it a little bit, kind of like a tasting menu, to see how it's working for you. The goal of this is to wake up the hips, to move your hips through their range of motion, and to get the body ready for the exercises that we're going to do after this. This one can also be done separately. When you wake up in the morning, it can be done on your bed. Super fabulous exercise. You will notice as you start to integrate these daily into your routine, the movements work better, flow better, feel better. Let's get a few more times to make it a full minute. Notice how your body is warming up, how your hips are starting to get a little bit more loose, a little bit less congested. That was 1 minute. Now we're going to do the same kind of exercise, but it's going to be a little bit more intense because we're doing it sitting up and we're doing one leg at a time. So you're leaning back on your hands and you're going to allow your legs to fall to your left. The timer is on. And we're going to take this right leg and we're going to start to lift it up. Now it doesn't have to be a big movement. The goal is to wake up the body and to move your hip through its optimal range of motion. An optimal range of motion is different than maximal range of motion. You want to be able to lubricate the joints to get the body movement. And what we're trying to do is move the thigh by itself and keep the rest of the body relatively still. But it's not a crime if the rest of the body is moving with you, because the goal again is to move your hip through its optimal range of motion. If this is too much for you, what do? Of course, you could just stop and go out for coffee, but what I suggest instead is you do it a little bit less, like I'm demonstrating now. Let's get a few more times. Again, moving that leg through its optimal range of motion, and the best part of this is how good it feels when you're done. Now we're going to do the other side. So we're going to swivel towards the opposite side, and now we're going to work this outside leg. So we're leaning towards the right, and we're going to work the left leg. The timer is on, and we're leaning back on the hands. And we're going to simply move this outside leg up and down. The beauty of this exercise, the beauty of every exercise, is that it's adaptable and adjustable for you. So let's say this is way too much for you to do. You can choose to make it a smaller movement, as I'm demonstrating now. And let's just say you've been doing this a while and you're getting better at it. You can work on keeping the rest of your body totally still as you do it. It doesn't need to be super fancy. It simply needs to get done. Let's get a few more times, taking your time, knowing that progress takes time, but it can be accelerated when you're consistent and intelligent about the exercises you do. Again, moving your hip through its optimal range of motion, trying to keep the rest of the body still. That was 1 minute. Let's just take a second here and notice for yourself how much more space and freedom you already have in your hips. And we're not even done yet. Now we're going to go swivel back to the first side. We're going to be working on this leg again, but instead of lifting it up and down like that, we're going to do the opposite movement, an internal rotation, lifting up the lower leg. So you're back on your hands. Maybe you want to put one hand on your hip, and you're simply going to lift and lower the leg. Now, what do you do if this is way too hard for you, if it feels impossible? You could put a blanket underneath that inner knee, or simply work on pushing that inner leg down into the floor until you build up some strength and capacity to be able to do this movement. And we're not looking for the biggest movement possible. We're looking for the healthiest, most precise movement possible. So please continue. We have about 30 more seconds. But remember, if you can't do it the full minute, that's all right. Take a break, come back to this practice, and work on increasing the amount of time you can do this. Remember, progress takes time. Small steps matter. Work intelligently, work consistently, and remember that exercise is like medicine. It's all about knowing how much is good for you today. So great. We're going to swivel this over to the other side. Again, we're going to work this back leg. The timer is on. I like to keep one hand on my hip so I can feel the muscles working. And it's an inward rotation of the leg. It's not going to be a big movement. If you wanted to make it a little bit harder, you could be like, look ma, no hands, and not use your arms at all. But that is not necessary. What is necessary is that you're taking this time for yourself to work your body, to work on this healthy range of motion, so the rest of the day you can move freely, have less pain, and feel better in the body you woke up in today. We have a few more times. Work on trying to keep the rest of the body still, and know that these are the kind of exercises where you don't have to push too hard. You really just need to show up and do them, if possible, most days. So great. That was the second side. The last exercise that we're going to do for healthy hips, that's part of our daily protocol, is what I call hip traction. So the way it works is that you're on all fours and you're going to take one leg back. So we're going to take the left leg back first. You can have a blanket underneath your knees for padding if you need it. And then all we're going to do is shift our body a little bit to the left. And what it is, it's a super fabulous stretch for the hip. If you feel like it's too much, you do it less. And the way I like to think about it is, imagine you had a flashlight on your sacrum or the middle of your pelvis. You're just shifting the light from going to the ceiling to going to a little to the left. It should feel good. And then once you're there, find your breath. Once you're there, lengthen your spine. Once you're there, enjoy the feeling of having some flexibility and space in your hip today. If you're not used to holding this stretch for 1 minute, do it less, no worries at all. It'll still count. Your body doesn't have a checklist about how long you're holding a stretch. It just knows when the stretch is working for you. Let's get about 2 more breaths. We're here for 1 minute. So useful and usable. And then we're coming back to the center, noticing the profound difference between the two sides. Now we're going to do the other side. So the right leg is back. And then you're going to shift your hips to the right. What we're looking for here is simply a stretch. We've shifted our hips to the right. You should have a nice stretch along the right hip and the right front of the thigh. If you need a break, you can come out of it, but see if you can get your spine a little bit long and enjoy this feeling of space in your hips. Let's get a few more deep breaths, maybe leaning a little bit more towards the right. Find something new in the body you've lived in all your life. Maybe it's a nice stretch on the hip, a nice lengthening of the back. Take a few more deep breaths. That's 1 full minute here. And then we're going to slowly return to the center. And then what I'd like you to do is I'd like you to see how you feel. And be a researcher and not a judge. Be interested in how these exercises affected you and how you're moving better throughout the day. If you want a longer hip mobility routine, we have a super fabulous one that you can follow along with at home. Just check the link below for our free hip mobility class and reach out with your questions.